everyone. Welcome to our ethical debate. We'll be focusing on the ethical use of punishment in applied behavior analysis. Delilah will represent the role of the prover who is arguing for the use of punishment. Becca will be taking on the role of the attacker, arguing against the use of punishment. And my name is Haley, and I will be assuming the role of the stater and the moderator during this debate. The use of punishment procedures in ABA has been heavily debated and researched for decades. Many professionals in behavior analysis feel that punishment has a negative connotation and will often avoid using such procedures. However, the BACB ethical code requires behavior analysts to rely on scientific knowledge and provide the most effective treatment possible. In addition to providing the most effective treatment, behavior analysts must consider a client's right to the least restrictive treatments available. In light of the precarious balance between optimal effectiveness and the level of restrictiveness in treatment, punishment can be very effective in treating dangerous behaviors in which reinforcement behaviors have proven ineffective. So, as you're probably aware, punishment is commonly viewed in a negative light, that it's something that's intended to cause harm. And depending on the individual's profession or frame of reference, there's a variety of different interpretations of what punishment is. So to avoid this confusion, we would first like to clarify what exactly we mean when we say punishment. In an article published by Cathcart, Peterson, and Palman in 2015, the word punishment is defined as a behavioral principle and a technical term that describes a relationship between a behavior and the consequences that follow. A behaviorist only considers punishment to be an action or consequence that actually results in the decrease in future frequency of a specific behavior. So like reinforcement, punishment is a behavioral principle and a natural phenomenon that occurs in everyday life. So an example of natural punishment would be roasting a marshmallow as a kid and being warned not to touch the hot end of the stick, but then accidentally touching it anyways and getting a painful burn, resulting in you being more cautious the next time and not burning yourself. There are two main types of punishment, positive and negative. Positive punishment refers to the addition of an aversive stimulus as a consequence to a behavior. And some examples of common positive punishments are spankings, electric shock, and restraints. Negative punishment refers to a subtraction or removal of a desirable stimulus as a consequence to a behavior. So examples of negative punishment include timeouts and response costs. And response costs refers to like loss of access to preferred toys or being able to go to recess. And then a punisher is a stimulus that is conditioned or reflexive, which decreases the likelihood of a behavior occurring again in the future. When they work together in tandem, the punisher and punishment can shape behavior. However, when considering the ethics of how behavior analysts should shape behavior, the pros and cons of reinforcement and punishment must be weighed in order to make informed and intentional decisions about programming them. So in schools, traditionally, punishment may consist of reprimands, detention, suspension, expulsion, but do they really impact the student's behavior? In many cases, the students receiving these detentions or reprimands will continue to engage in the problem behavior, and therefore we would not consider that to be punishment. So in our debate, we will be focusing on issues including the effectiveness of punishment procedures and the client's right to the most effective treatments available, as well as the negative side effects which have been associated with the use of punishment. The second topic we're going to cover pertains to the functionality of punishment procedures with behaviors that are of the more complex variety versus the issues associated with the consistency of punishment procedures and its inability to generalize a desired behavior. And then our third topic will address the occurrence of punishment in our natural environment and other common uses of punishment used in everyday life that we may not realize are occurring. This will be followed by a rebuttal claiming that punishment in our natural environment is contingent upon the presence of reinforcement and why reinforcement is actually the more plausible option. And Delilah will start us off by providing her first argument for the use of punishment.
Hi, I'm Delilah, and essentially, it's important for the behavioral science community, as well as parents of children with ASD and other stakeholders, to know that punishment can be both ethical and effective. Punishment has an overgeneralized negative connotation in our society. In ABA, punishment refers to a consequence that reduces the likelihood that a behavior will occur again in the future. Punishment can be as simple as ignoring an inappropriate behavior or a timeout. However, if something is viewed as or meant to be aversive, as Haley mentioned, it is only a punisher if it decreases the chance that the behavior will occur again in the future. For instance, in my personal experience, I know that I've punished behavior by utilizing functional communication training with clients. The whole point of using functional communication training is to teach an alternate behavior, which includes putting other behaviors like crying or whining vocals on extinction, thereby only allowing one response to provide reinforcement, which essentially decreases the likelihood of other behaviors occurring in the future that don't access reinforcement due to punishment. Moreover, the BACB ethical code in which we have in place provides the necessary parameters and guidance to effectively deliver punishment procedures. The BACB ethical code, first and foremost, refers to the fact that we have a responsibility to the people that we treat. As mentioned by Lerman and Vondran 2002, our clients have the right to safe, acceptable, and highly effective technologies of behavior change, which should be available to consumers who request them, including procedures that are based on punishment. And the support for that comes directly from the BACB Ethical Code 2.09, Treatment and Intervention Efficacy. Part B of Code 2.09 states that behavior analysts have the responsibility to advocate for the appropriate amount and level of service provision and oversight required to meet the defined behavioral change program goals. According to the code, this includes a cost, benefit, and risk analysis of interventions. Also, in example code 2.09 Part D, behavioral analysts review and appraise the effects of treatments in which they are aware might impact the goals of the behavior change program and their possible impact on the behavioral change program to the fullest extent possible. There's even an ethical code that refers directly to punishment procedures. Code 4.08, Considerations Regarding Punishment Procedures, states that behavioral analysts should recommend reinforcement over punishment whenever possible. Also, if punishment procedures are absolutely necessary, reinforcement procedures must be used and replacement behaviors must be taught. Also, before implementation of punishment procedures, behavioral analysts must take the appropriate steps to implement reinforcement-based procedures unless the target behavior is severe and or dangerous to the client or others and may require immediate intervention, potentially using aversive procedures. The use of aversive procedures must be coupled with an increase in training, supervision, and oversight across all staff who are involved in the implementation of the punishment procedure. Also, effectiveness must be monitored very closely and often, with modifications being made whenever necessary, whether it's due to ineffectiveness or other dynamic factors that are involved with essentially dealing with humans. Also, a plan to either discontinue or fade out aversive and punishment procedures must be included.
There are many negative side effects associated with punishment. The BACB Ethical Code 2.09, Treatment and Intervention Efficacy, states that in the instances where more than one scientifically supported treatment has been established, additional factors may be considered in selecting interventions, including, but not limited to, efficiency and cost effectiveness, risk and side effects of the interventions, client preference, and practitioner experience and training. So when we're looking at that code, we really need to focus in on practitioner experience and training. Some punishment procedures that happen in ABA clinics or in-home therapy include restraints, like safety care or any sort of safety care training like that, where if a behavior becomes too escalated and the safety of the therapist or the client or other clients becomes a risk, they need to be able to be well trained to effectively carry out that hold. If they're not effectively trained and injury is caused to the therapist or the client, that can result in a lot of legal backlash. So when we think about these punishment procedures where we're essentially basically just confining the client to one specific spot, we really need to think about what repercussions this can cause. And then additionally, with .209, we need to really think about the side effects of punishment interventions. I'll speak more about this later on, but every client has a different history with certain punishers and reinforcement. So it's not appropriate to use something that might be harmful or has been harmful to the client. We really need to look into if the client has had past abuse in their life. Unfortunately, the client could have been under some guardians that have used inappropriate reinforcers. So that's one thing we need to keep in mind with punishment procedures. We need to think about, okay, is this punishment procedure safe for the client? Is it a procedure that is least restrictive comparison to reinforcement strategies? In the BACB Ethical Code .209, we know that behavior analysts review and appraise restrictiveness of procedures and always recommend the least restrictive procedures likely to be effective. For example, if you're having a client that engages in inappropriate verbal behavior, you're not going to immediately throw him into exclusionary timeout and remove all reinforcers and all attention. Would that work? It might, but is it the least restrictive? It's not. It's not the least restrictive when functional communication can be taught or when we can simply ignore the inappropriate verbal behavior. In a survey of 141 BCBAs, BCABAs, and licensed psychologists, most of them viewed punishment procedures as less effective than positive reinforcement. The respondents rated their responses on a 6-point Likert scale, which was set from strongly disagree to strongly agree. The median score was 4.8 on that 6-point scale. The average time spent in the field of ABA was 12 years. So when we're looking at professionals that have been in the field and that implement reinforcement and punishment procedures every day, we need to look at what they view as most effective. Here's the table right now. If you look down here, this was the statement that I'm referring to. The statement is punishment has more negative side effects than positive reinforcement. So that's taking the opinion of seasoned professionals. And if you look over here too, one of the other statements is positive reinforcement is more effective than punishment at changing behavior. So with those two statements, we can gather that one is clearly more effective than the other. C.D. Webster portrayed shock therapy as an abuse of power by mental health professionals in institutional settings that should no longer be tolerated. So this is referring to a past study about the use of shock treatment. And back when there wasn't as much research on reinforcement, not a lot of people questioned the efficacy of the aversive therapy, and a lot of parents came to the defense of the shock therapy to say it was the only thing that helped their child. But eventually there became more of a rise in the study of reinforcement as it compares to punishment. And we found that there are very effective positive alternatives, and that positive reinforcement alone could potentially be the most effective. Julia Bascom, an activist with autism, refers to ABA therapy as abuse, which is a very strong statement. And Julia actually echoes a lot of people with autism who have undergone ABA therapy, and she actually states that some of these people have left this treatment feeling traumatized and devalued. So another thing we need to consider with punishment is not only can it be physically and emotionally challenging for the client, it can be psychologically damaging. We never know down the line what our actions with ABA therapy can cause for these clients.
In light of Becca's points, critics often fail to realize that ABA utilizes a wide range of approaches in order to shape behavior in ways that are naturalistic. Contemporary ABA it's not the same type of behavioral modification seen in past decades, like the horrific malpractice of behavior modifiers in Sunland, Miami in the 1970s. And it does not always include the use of or focus on aversive techniques and procedures. Moreover, as stated by Kirkham 2017, the best known medical treatments for autism is ABA, with procedural and ethical safeguards in place for the use of punishment procedures. Also, Richard Hastings, 2013, a psychology professor at Warwick University, similarly said, it is people, not approaches or theoretical positions, that abuse other people, implying that ABA itself should be defended because it's not the core problem of where malpractice or misuse of punishment procedures come in. It's human error, and that blame should not be placed on ABA, but the practitioners themselves, and they should be fulfilling their due diligence and in line with the ethical code in which certified staff should be heeding to. In addition to that, Critchfield 2018 discusses in his paper, Skeptics Corner, Punishment, Destructive Force, or Valuable Social Adhesive. And they shared data from Gurek et al., a 2006 study of board game players gradually choosing to take part in a game that includes the option to punish other players, rather than partaking in a game that does not give an option to punish other players. This data, along with the study, reinforces the notion that punishment can be interpreted as socially acceptable and valuable when working towards a common goal, or when the benefit of the group outweighs the benefit of the individual. Also, it's really important for parents with children who may potentially need punishment procedures in place that punishment does not always have to be extremely aversive or potentially painful stimuli. We're not shocking clients in ABA clinics. We're definitely not spanking clients or anything of specific painful nature by any means, especially considering that one of our principles is to do no harm. And one thing that's really awesome about ABA is that we can utilize ABA principles in order to use neutral stimuli to be conditioned to elicit a punishing effect, which can in turn increase efficacy and acceptability in clinical settings, and essentially social validity outside of the clinical setting as well. As mentioned in Lerman and Borndran 2002, Dixon, Helsel, Rohan, Cipioni, and Lubetsky's 1989 study paired a mild, less effective punisher, just a visual screen, with a punisher that was more effective and potent, the pungent odor of ammonia. And while treating aggression and disruptive behavior in a young boy with developmental disabilities, the visual screen was then used as a potential or as a positive punishment for engaging in the target behavior. And the visual screen did result in lowering the rate of the target behavior. Aversive conditioning can allow for the use of less restrictive treatments. Punishment can still fall under that umbrella of a less restrictive treatment, as referred to earlier by Becca, the BCABA or BACB code 4.09, which directly refers to the least restrictive procedures likely to be effective.
Effective punishment needs to be consistent. When reinforcement can be on an intermittent schedule, punishment needs to occur after each behavior. Punishment does not do well to generalize the desired behavior. So when we're talking about reinforcement schedules and punishment, when we're treating clients in a clinic, it's our job to be able to catch everything that needs to be punished or everything that needs to be reinforced. And we can really focus in on all of those occurrences. But when we're talking about taking ABA outside of the clinic and teaching parents and guardians how to reinforce and how to put target behaviors on extinction, we need to think about their life too. And we need to think about, okay, is it effective to have put these target behaviors on a specific punishment schedule when mom and dad still need to do shopping and mom and dad still need to go to events and they need to go out in public? Or can we teach them how to reinforce these certain behaviors and get the child on a VR schedule, maybe a VR2 or VR3, where the child can be content and can engage in more functional behaviors, knowing that every third time I do this, I get a Sour Patch Kid, rather than expecting these parents and guardians who have a million other things on their mind to be able to catch all the behaviors that need to be punished. The best known intermittent punishment may complicate treatment success. Lerman and Vondran say that previous learning histories can decrease the effectiveness of a punishment. So it kind of goes back to the point I was making earlier about how we're really unsure about every client's history with a punisher. For example, you can have a client who unfortunately was abused, and maybe they were abused and they were shut away in a room by themselves. And then as a BCBA, maybe you implement an exclusionary timeout, and suddenly this child is experiencing awful, horrific flashbacks of that abuse that can either make the punishment completely ineffective or can completely put them in a state of panic and unknowing. They can lose trust with the therapist. So in addition, other factors that need to be considered with punishment and providing intermittent punishment is what schedule you're putting the punishment on. Is the child on a schedule where not enough instances are being punished or too many? With reinforcement, since they're receiving something to increase the likelihood of the behavior, or they're having something removed to increase the likelihood of the behavior, that can be easier to make attainable to that child. For example, it could be a piece of cereal or a piece of candy, something that can quickly be handed out. But we also need to think about the magnitude and the immediacy of these reinforcers and punishment. It could be that a child's punishment for hitting a sibling engaging in aggression with their sibling is response cost. But if say the response cost is for the removal of a preferred activity, but the parent is already at the pool or use a therapist or at, a public pool with a client, that's going to be harder to remove the child from that environment. So when we're thinking about punishment, and we're not able to be effective with actually implementing those punishment procedures, we need to really think about how reinforcement and teaching these functional alternatives can overall be more effective for the client. Helvey and Schramer did some research with rats that determined that intermittent punishment decreases the effectiveness of continuous schedules of punishment. And what they did is the rats received shock therapy as their punishment, and the punishment was proven ineffective even when several days and weeks went by of being on this intermittent schedule until they started a continuous schedule. So with punishment, you really have to be on top of it, and it really has to be after each target response or it won't be effective. Even if you take a break in this punishment schedule and you move on to something continuous, it will not be effective because that client, or in this case, that rat, has experienced what an intermittent schedule of punishment looks like. This study was also replicated in 1970 with typically developing children with the sound of a loud buzzer. So not only is it happening in a rodent, but the same treatment can be replicated with children who learn that if punishment was on an intermittent schedule and now it's on a continuous, it's still not effective.
Well, as I mentioned earlier, punishment can be and is as natural as positive reinforcement. There can be some difficulties in terms of removal in certain settings, as Becca mentioned earlier, but the fact of the matter is that punishment is almost, if not more natural than reinforcement, because it underlies many of the positive reinforcement-based strategies that we utilize in ABA. Other ABA positive reinforcement procedures are often paired with punishment procedures for maximum efficacy. Plus, punishment can be crucial in treatment when variables maintaining problem behavior can't be determined or matched by a functional replacement behavior. It's especially important for parents to know that often behavioral functions are not cut and dry, and this muddying of the waters, this complexity, may require the tool of punishment. Punishment is very useful when the response to reinforcement relationship cannot be terminated completely. Examples of this include situations where the function of behavior cannot be determined or isolated. Sometimes there's more than one function of behavior involved, and you may be able to provide an alternative for one of those, and you may not be able to provide an alternative to meet the other function. And in this case, punishment might be the only option. This may also be the case when the function of behavior is not socially mediated, such as automatic or sensory functions, where it can be difficult to antecedently intervene or develop an appropriate replacement behavior. And even if an intervention requires a response block, that's still considered punishment. In addition to that, punishment can reduce problem behaviors quickly, especially when the behavior is dangerous to oneself or others. These kinds of dangerous behaviors include self-injurious behaviors, property destruction, and physical aggression. Once again, the punisher does not have to be highly aversive, but does have to act as a consequence that decreases the occurrence of the behavior in the future. Lerman and Warndran, 2002, cited Dorsey, Iwata, Ong, and McSween's 1980 study in which they paired the word no with contingent water mist for 2 participants who engaged in self-injury. Results show that contingent presentation of the verbal stimulus maintained low levels of self-injury when the water mist was then withdrawn from the original treatment setting. And this just shows you punishment doesn't have to be painful. It doesn't have to be this pungently aversive thing. A water miss is not going to hurt you. Might be a little annoying, but it's not painful or physically harmful by any means. And that water mist being paired with no was able to boost and increase the efficacy of the verbal reprimand of no, which is totally socially appropriate. And that in itself, they were able to transfer that stimulus control and reduce physically harmful behavior. Also, as cited by Lerman and Vondra in 2002, some authors also have suggested that the contingent loss of reinforcement associated with differential reinforcement procedures, such as DROs, DRAs, etc., that in itself is a form of punishment. If you're differentially reinforcing some behaviors over others, that means that you can't help but to be putting those other problem or targeted behaviors on extinction, whatever that may mean. You're not allowing those other responses to help an individual gain access to reinforcement. So even when we are delivering these reinforcement procedures, things like differential reinforcement is right there in the phrase. However, utilizing this reinforcement procedure, punishment is still an underlying current that is drawing and shaping the behavior in the way and in the route of inappropriate behavior that will allow access to reinforcement. Just shows you that not receiving reinforcement for an incorrect response is essentially a missed opportunity to access reinforcement, which could be perceived as response costs, which is technically a punishment. In addition to that, punishment procedures can easily occur inadvertently without even realizing, and is associated with other processes that reduce problem behavior through the mechanism of punishment. Procedures like I mentioned earlier, response blocking, even guided compliance, and even the application of protective equipment like gloves or bike gloves or any type of shield, anything like that. You're not allowing that aggression reinforcement to occur when you use protective equipment. So, and that often helps reduce the problem behavior. But by terminating that reinforcement contingency, by using the protective equipment, you aren't allowing them to gain access to reinforcement that's maintaining whatever response you are trying to reduce. Also, contingent loss of reinforcement can function as punishment and still be an underlying component, whether or not a specific punishment procedure is explicitly in place. Punishment is still occurring, whether or not we're meaning for it to occur, just due to the natural flow of life and its consequences. Moreover, punishment paired with other procedures, reinforcement procedures like functional communication training, can be very beneficial, more beneficial than if a positive reinforcement or reinforcement procedure is left on its own to treat a behavior. As described by Hanley, Piazza, Fisher, and Maglieri, in which they delved into the use of functional communication training plus punishment, and it proved more effective than solely using functional communication training alone. Punishment in ABA therapy can be successful when accompanied with treatment that teaches functional alternatives to negative behavior. The study I just mentioned studied that specific effectiveness with and without the punishment component. And they also studied the participants' preference for each treatment. And the results showed that FCT utilizing punishment procedures was more effective and more preferred by participants. So not only do we have that efficacious component that we're of course, very concerned of in shaping behavior, but we also have that crucial social validity of participants actually preferring the procedure that involved punishment over one that did not. Moreover, Hanley, Piazza, Fisher, Contrucci, and Magliari in 1997 developed a way to test participants who were children by pairing different colored switches with the delivery of a specific treatment. Those treatments were NCR, FCT, paired with DRA, which includes extinction, or extinction alone. Both the FCT and NCR treatments were effective in reducing problem behavior, but the FCT intervention was preferred by the participants. This also brings to light the potential for more opportunities for children and clients with limited communication to communicate their preference for intervention. So we're not just talking about consent from involved stakeholders or consent from parents and guardians. This 1997 study shows us that children, even children with a variety of communication levels and strategies, can potentially tell us which procedure they prefer. And in this specific instance, it was preferred to utilize the FCT paired with DRA, which includes extinction.
Punishment and reinforcement are both intermittent in the natural environment. Every day, without us knowing, we are being punished for certain behaviors and reinforced for certain behaviors, even if the reinforcement or punishment is simply silence. Therefore, punishment is not as effective as it could be in a contrived setting due to habituation. So problem behavior is likely to be maintained by some sort of reinforcement during treatment. And Lerman and Vorndran in 2002 state, responses during punishment may depend on the reinforcement schedule that maintains the behavior. We could think of a client who could withhold engaging in the negative behavior until he or she receives reinforcement for a DRO schedule. Sometimes with these schedules, it just kind of depends on how quickly the client catches onto the schedule. We can think about a client who engages in smearing fecal matter during exclusionary timeout because they're aware that they're not receiving attention. The punishment in this case gives an opportunity for the client to engage in problem behavior. So sometimes when we're using punishment, like response costs for DROs or for failed DROs or exclusionary timeout for other behaviors, we really need to consider, is this just giving the client an opportunity to engage in the targeted punishment behavior or replace it with a different negative behavior? If problem behavior is likely to be maintained by reinforcement, it is better to reinforce a positive functional alternative behavior rather than punish a negative behavior. And that's something that both Delilah and I have spoke about in this debate. For example, it's better to introduce stickers as a functional equivalent for a client who picks at paint or picks at carpet, rather than to put the child in some sort of punishment procedure. The child is able to engage in a functional alternative that is safe, non-intrusive to the environment, and creative, rather than ignore the child and remove them from the current social environment. Removing the child from the environment could also draw attention to the negative behavior. We have to remember for our clients that they pick up on our behavior too. So if they learn, hey, when I do engage in this behavior, I get ignored, and maybe I like being ignored, or maybe now that I'm being ignored, I can just engage in a different behavior. Our clients are very smart, so we need to keep that in mind when making these punishment procedures.
So overall, we know that punishment has been proven to cause a variety of negative side effects, but studies also provide evidence that punishment procedures are extremely effective when used properly. Culturally, it's assumed that punishment is punishment for every person. But for example, as a child, when my boyfriend, who was diagnosed with Asperger's, when he would engage in problem behavior, his mother would take him into another room and give him a spanking. However, my boyfriend has an insensitivity to pain, so he would just receive his spanking and then just return to whatever he was doing in the first place. So this punishment was more of an inconvenience for him than a punishment, as we think of punishment. It wasn't changing his rate of behavior. So this is just an example that shows us that what is punishment for one person is not may not function as a punishment for another person, which is why developing individualized behavior change programs are so important. When punishment does need to be used, punishment procedures should only be implemented by behavior analysts who are competent, meaning they have been properly trained in the use of punishment strategies. Punishment is an effective intervention strategy that should be used with careful consideration after all alternative strategies have proven to be ineffective. Procedures focused on reinforcement are much less restrictive than punishment procedures. Therefore, reinforcement intervention options should always be given priority before punishment is even a topic for discussion. In situations when punishment is necessary, behavior analysts are responsible for conducting a cost-benefit analysis to determine if a punishment procedure is really in the best interest of the client. Written consent will be obtained from either the client or the client's parental guardian before moving forward with anything. Behavior analysts will make sure that sufficient procedural regulations and safeguards are established and that proper training has been provided before implementing any punishment procedures into a behavior change program. Punishment has been and still is a very controversial issue in the fields of applied behavior analysis, and as was explained by Kirkham in 2017, there is a lack of meaningful dialogue that's going on between supporters and detractors of different aspects of ABA, and especially punishment. So these controversies are unlikely to end in the near future. So we need to continue discussing the use of punishment so that, I don't know. Well, on that note, we will conclude our debate. We hope that you were able to take something away from our presentation. Thank you for listening.